Welcome to the Hidden Truth Show and our deep dive into the AA movement. It's called AA Kills. In this episode, we've got an interview with Dr. Mark Willenbring. He's a professor at the University of Minnesota in psychiatry, and he also served in the National Institute of Health in Bethesda, Maryland. It was there that he learned about all kinds of new discoveries that have been found to help treat addiction as a result of federal funding to universities. But he found that all of these methods were not making their way to addicts, that instead addicts were continuing to simply use the 12-step program. He wants to bring these to light. He wants to put the 12-step program out of business. Check out this excerpt from our episode, Hidden Truth, AA Kills.
Well, first of all, it's important to distinguish between 12-step treatment programs or 12-step rehabs and 12-step community groups because they're completely different.
Well, let's start with the 12 steps itself. What are your thoughts about the 12 steps?
Well, AA as an organization is simply an association, a voluntary association that people choose to affiliate with if it works for them. It's not a treatment, it's a support group.
Right.
And so there are, it's a minority of people with substance use disorders who affiliate. For the people who do, that's fine. It seems to work fine. And if my patients are affiliates, that's fine. Most of my patients will say they go for the fellowship, which means they go for the social context, not they don't really do step work or work with a sponsor. Others really do. On the other hand, 12-step treatment programs are professional programs. They're licensed by the state and they charge a fee for their services. They incorporate some principles of AA into their clinics, but they're not AA.
Yeah. Well, I read something that rehab clinics in the U.S., approximately 70 to 80% of them utilize the 12-step program.
That's correct. It's actually probably more like 80 to 85, but yeah, that's right. So for most people, that's all they have available.
So they might be in a rehab program that they're paying a lot of money for, but that
they might.
Program, yeah.
Most people really don't. I mean, most treatment in the United States is publicly funded. The vast majority of it.
So you're talking about like a county rehab clinic?
Yeah, or there are private rehab clinics that are within insurance networks and so forth. And they're nowhere near as expensive. There's a lot of attention to the high end, as there is in everything these days. It's actually ironic because people who are rich and famous get the worst treatment, which is not unusual, but it's particularly stark in this realm.
You're talking about some of these places, for instance, in Malibu.
Yeah, Malibu is a magnet. Scottsdale, Arizona, and especially Delray Beach, Florida, Pine County, Florida, or Beach County, Florida, has got like 300 rehabs.
And what's your critique of these places?
Where do you start? The high-end rehabs, by and large, are kind of crooked, and they don't provide any. Their treatment is not superior in any way at all. But the thing is that it doesn't really matter what you do in rehab. There's no evidence way to do rehab because rehab isn't evidence-based. Never has been, never will be. Addiction is a chronic illness. You can't treat a chronic illness in 4 to 6 weeks. So the founders actually knew this. The founders of the Minnesota model knew this. So originally rehab was meant to be an entree into AA. So you had a week of attention to the body. You had treating withdrawal, treating 3 hots in a cot, medical workups, whatever. So people got comfortable, got their head clear, And then 2 weeks of education in alcoholism as a disease, according to that model, and an introduction to AA. So they'd go out to AA meetings during that time. And then the last week was a discharge planning. Now, the thing is that they didn't expect anything to really happen during rehab. What they expected was that the work would begin when you got into AA. The work was in AA, and it took place over a long period of time. The so-called spiritual transformation that they talk about would occur subtly and over a long period of time, usually with multiple relapses and recoveries, until somebody really caught it. So the idea, but over time, this idea changed, and it changed into one where something magical was supposed to happen during rehab. Nothing magical happens in rehab. Rehab is just rehab.
Well, define rehab for me.
Rehab is a period of intensive, low quality counseling and education and an introduction to AA. That's what rehab is.
And it's getting you clean, at least temporarily.
Well, yeah. So what? I mean, it's the. So here's the thing: is that you can't learn recovery skills in rehab. So here's my analogy. Going to rehab is like going to a basketball camp. While you're at the basketball camp, you read about these rules and strategies of basketball. You see videos of people playing basketball. Former and current basketball players come in and talk about playing basketball. But while you're there, you never set foot in the court and you never touch a ball. And then they discharge you and they say, go play basketball. No, that makes no sense at all. And it doesn't work. Now,
well, I would imagine you would also even challenge, are they even teaching you basketball correctly?
Well, they're not actually. Most programs really don't even provide what's called 12-step facilitation. So 12-step programs will hide behind that. So there was a study a few years back called the MATCH study, and they compared CBT, cognitive behavior therapy, motivational enhancement therapy, and 12-step facilitation. So they manualized a 12-step treatment program. But they didn't do it in an inpatient. They did it in an outpatient, moderately intensive, with high quality counselors. So the counselors had MAs and PhDs. They were intensely monitored. The sessions were recorded, et cetera, which all improved the internal validity of the trial, but it had nothing to do with the real world. And what they found was that they all work about the same. Now, Kathleen Carroll, I'm sorry. Kathleen Carroll did a study of real world 12-step treatment. And she did it through the National Trials Network put together by NIDA, which was allegedly going to spread evidence-based practices. It hasn't done anything like that. But at any rate, it's the rehab chosen for that are actually quite, they're at the top tier. They're the top 25% or higher of the community programs to affiliate with the research center. And even in those centers, and even though people knew they were being monitored, hardly any treatment at all took place. It was mostly simply general chat. That's what they ended up calling it, chat. So they'd come in and they'd talk about how their cat died last night, and they kind of general talk about recovery and so forth. But very, the interventions they did, pardon me, were actually pretty good, but they just didn't do very many, and they didn't go any depth.
Is there individual counseling going on at those clinics?
Yes, a little bit. There was mostly group, but there was some individual, and they captured the individual sessions.
And are they going into childhood issues, for instance?
Are they going into what?
Childhood issues.
No.
No.
Basically, they don't go into anything.
Okay, so we've been talking about the celebrity rehab clinics. You said that some of the ones that are publicly funded are better. In what way are they a little bit better?
Well, some of the programs, like in Minnesota, some of the programs are halfway decent. They still are 12-step based. Most of what they teach you is wrong, scientifically wrong. And most of them are anti-medication, which is stupid.
If you enjoyed that excerpt, go check out Hidden Truth Show, AA Kills, wherever you listen to podcasts. The Hidden Truth Show, AA Kills, wherever you listen to podcasts. I'm Jim Breslow.